If you're working out and eating healthy, like I am, you're hard at work in helping to prevent coronary heart disease, a condition caused by plaque buildup in the arteries. But another problem may be lurking in the valves of your heart that is a separate issue entirely. It's called structural heart disease. Dr. Hassan Pervaiz, an interventional cardiologist with Texas Health Heart and Vascular Specialists, is here to have a heart-to-heart, so to speak, about structural heart disease. Good morning. It's so nice to have you with us this morning.
Thank you.
Really appreciate your time.
Thanks.
So let's just start. A lot of people are concerned about heart disease. It's a serious problem. Let's start with a good understanding of what is structural heart disease and how does it differ from coronary heart disease, which I know we've all heard of.
Sure. So if you look inside the heart, you will find there are 4 heart valves, 2 on the right side and 2 on the left. So the left-sided valves are called aortic valve and mitral valve, and the right-sided are called tricuspid and pulmonic valves. For the heart to pump blood efficiently, these valves have to work in close harmony. So they open and close with each heartbeat. So problem in one of these heart valves is the most common type of structural heart disease. So what can happen as you grow old, you can form calcium on the valve. So when you form calcium, the valve may not open properly.
Right.
And the other problem that can happen is leaky valve. Okay, it's the same thing. When the heart pumps blood, the valves have to close and they should not let any blood go backwards. So a leaky valve is where it's not closing properly and the blood is going back. So as opposed to that, coronary artery disease is cholesterol buildup inside the blood vessel of the heart that typically leads to a heart attack. So that's the difference.
All right.
Structural heart disease is mainly valvular heart problems, sometimes hole in the heart or a thick heart muscle. And coronary artery disease is something that causes heart attack.
So how would someone, what are the symptoms that you would notice? How would you know if you had structural heart disease?
Yeah, most frequently when we listen to the heart sounds, we can hear a murmur. So if your primary care physician tells you you have a heart murmur, we do an echocardiogram to confirm the diagnosis to see if the valve is leaky or if there is a narrow heart valve. Symptoms most commonly are more vague but can be significant, like shortness of breath, getting lightheaded or dizzy, swelling in the legs, fatigue, easy fatigue. So these are typical symptoms. So again, if some patient has these symptoms, we do an echocardiogram and look at the structure of the heart to see if there is any structural heart disease.
So obviously it's a very serious condition, but you say you're very hopeful when it comes to treatment. How so?
Yeah, there is a growing excitement about this field over the last 20 years. There have been a lot of innovations. So let me give you an example. Aortic valve is a common valve. It can get narrow as you age, and we develop aortic stenosis. So previously, the only way you could fix it was open heart surgery. And some older patients cannot survive open heart surgery. So what we do now is we use a valve through the groin with a minimally invasive procedure. So this is called TAVR valve, and this is another example of such valves. So what we do is the patient comes from home on the day of the procedure. We put the patient to sleep, we numb up the groin area and put a catheter or tube. And through that catheter, we move this valve up and put it where it needs to be. And so basically we are replacing the heart valve without having to cut open the chest. Another example of that is mitral clip. So I told you about one of the valves called mitral valve. So that can develop mitral regurgitation or leaky valve. So this is a clip that we can use again with minimally invasive route to put a clip on the valve for the leaky part of the valve, and the leakage can go away and the patients can feel better immediately.
I'm always amazed at modern medicine. It's just incredible. So, and there are procedures that can reduce the reliance on medications.
Yeah, whenever we can get rid of long-term use of medications, the patient outcomes are always better. So let me give you an example. Atrial fibrillation is a common heart rhythm problem, and atrial fibrillation can lead to blood clot formation inside the heart, and that can go to the brain and cause a stroke. So previously the only option was to be on a blood thinner, but being on a blood thinner increases risk of bleeding.
Right.
So at one point you are trying to reduce the risk of stroke and also giving the patient more risk of bleeding. So what we have now is a procedure called Watchmen Procedure. This is again, we go through the groin, patient comes on the day of the procedure, we put a catheter in the groin. So we deploy this device in the left side of the heart where usually you form a blood clot. So this acts as a filter. So after that, you can get rid of the need of blood thinner for the rest of your life.
Thank you so much for being with us this morning. Modern medicine is amazing. If you want more information on any of this, go to thpg.org/heart disease for more information, or call 866-760-1723.